My name's Ravi Patel. My practice is in Monmouth County, New Jersey, part of Atlantic Eye, and I'm also on the cornea service at Wills Eye Hospital. So I discovered mechanical dry eye a little bit early in my practice. When I was a resident, we treated dry eye disease exactly the same way as everybody else. Drops, thicker drops, and the thickest drops. But as time went on, we found that there were patients that just weren't getting better. They had these symptoms that just seemed to be resistant to conventional therapy. One of my earlier patients in practice had come to see me because she had this chronic filmy vision. It didn't really change during the course of the day. It was the same in the morning, in the evening. She'd been through every anti-inflammatory drop that you could imagine. And when we looked at her eye, she had mechanical dry eye disease, or what we would today call mechanical dry eye disease. But I had no idea what it was. She had all this stuff going on her eyes, and so we did a small procedure in the operating room, and it really made her better. I was impressed. She came back the next day, and I'm like, wow, that's how I discovered mechanical dry eye. So the typical patient that comes in is one that's really frustrated. They've been visiting many doctors, have been put on many different types of drops. Their comorbid conditions like blepharitis have already been treated. And when you examine them, you notice that they have excess conjunctiva that seems to be billowing over the lower lid margin. We see these patients and I ask them a simple question. How does your vision change during the course of the day? And they say, it really doesn't. It's bad all day. Breakfast, lunch, dinner, which is really atypical for traditional dry eye disease. So for these patients, I take a Q-tip and I'll just mop up the excess tears that they're making, and I'll wait to see how long it takes for them to repopulate their tears. And to restore the tear meniscus, if it takes them at least blinking once for that to happen, they have symptomatic mechanical dry eye disease. And these are the patients that I'll offer surgical correction to. So my message to my peers is simple. Look and examine your patients carefully. I wish that I knew about mechanical dry eye disease even earlier than I found out about it, because these are some of the happiest patients in my practice and some of our largest referral sources. So I would tell all of you, examine, 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 and you'll find this disease because it occurs much more commonly than you think of. And once you treat these patients, it's going to be gratifying not only for them, but for you as well.